Yeah, good to see you. Good to meet you.
Nice one, likewise. Oh.
Very
Yeah.
privileged. Okay.
Yeah.
I do. Office, actually, Chief building. I know where that is.
Yep.
I've
Great.
been there for 17 years. I moved in there
Yes.
with Mary Birch.
Ah, yeah.
Just still in,
Yeah.
but I've been doing that
Everybody here ready?
for 35 years.
Wow. Okay. Good afternoon. I'm Greg Musil, the chairman of the Charter Commission. I'm going to call the meeting to order. It is Monday, July 12th, 4 o'clock, a little after 4 o'clock p.m. I am in the Johnson County Administration Building in room 200, along with several members of the commission. We have other members of the commission who are appearing via Zoom. And we have our presenters who will also appear, as I understand it, via Zoom. Members of the public are able to observe this also by the Zoom link and by Facebook Live, I understand. The first order of business is a roll call and determination of a quorum. So if Deputy County Clerk Linda Sater would call the roll, and if you're on Zoom, be prepared alphabetically to answer if you're here.
Wendy Bangazer.
Wendy Benjamin, present.
Mike Bain.
Mike Bain here.
Karen Brownlee will be coming in late, about 4:30. Vicki Charlesworth.
Vicki Charlesworth, present.
Jim Denning.
Jim Denning here.
Jane Dirks.
Jane Dirks, present.
Jimmy Gaona.
Jimmy Gainer present.
Tedrick Hausch.
Edric Couch, present.
Randy Hutchins.
Randy Hutchins here.
Chris Iliff.
Chris Iliff here.
Laura Klingensmith.
Laura Klinging-Smith, present.
Joy Costin.
Joy Costin, present.
Brent McCune.
Brent McKeon, present.
Eric Michelson.
Eric Michelson present.
Ed Peterson.
Ed Peterson, present.
Don Rattan.
Don Rattan, present.
Leslie Riverola.
Leslie Riverola is here.
Don Roberts.
Don Roberts, president.
Kyle Russell.
Al Russell, present.
Paula Schwak.
Paula Schwag, present.
Brenda Sharp. Brenda Sharp.
Brenda had texted me and said she might be a few minutes late joining the meeting just a few minutes ago.
Thank you. Greg Shelton.
Greg Shelton is here.
Greg Smith. Greg Smith.
I think Greg had indicated to me last meeting that he would be unavailable for this meeting.
Okay. Zach Thomas.
Zach Thomas, present.
And Chairman Musel.
Chairman Musil here. Comfortably have a quorum. I think there were 2 or 3 people missing out of the 25 members of the commission. I think for members of the public, it might be helpful to remind them that we are here as part of a every 10-year review of the home rule charter that governs Johnson County government. First adopted by the voters in 2000, reviewed in 2011, and now reviewed again in 2021. We're a 21-member commission appointed by various elected officials, chambers of commerce, political parties, to represent hopefully a cross-section of the county. And this is, we've been meeting and doing County Government 101, hearing from county agencies and departments to learn more about Johnson County before we fully engage in the review of the current charter. The first item on the agenda after roll call and quorum is consideration of the approval of today's agenda. Are there any changes to the agenda as published, or would someone make a motion to approve?
I'd move to approve the agenda. as
Motion,
presented.
motion by Mr. McCune.
Wendy
Second
Van
by,
Gessen, I second the motion.
Wendy, before you, I had a second from Mayor Michelson here in the room, so I might default and favor those in the room that I can see quickly, but we have a motion and a second to approve the agenda. All those in favor say aye.
Aye.
Any opposed, nay? That motion carries without objection. The second item then is the approval of the minutes from the June 23rd, 2021 meeting, which were circulated to the commission earlier along with the agenda. Are there any additions or corrections to the minutes as circulated? Hearing none, I would accept a motion to approve the minutes as presented.
I would move to approve the June 23rd minutes as presented.
I'm going to take the motion from Senator Denning and the second from Mr. McCune, if that's acceptable. Been moved and seconded to approve the minutes. Is there any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed, nay? Thank you. The minutes are approved without objection. We don't have any old business. We have a couple items of new business before we get into our 4 presentations today. I just put these as reminders. We have received some questions for the sitting county commissioners and the former county managers. If you have questions you would like to have answered, the sitting county commissioners are scheduled for our August 9th meeting, so we need to get those questions in so we can present those to the commissioners. So please submit those questions to Linda Sater if you have those. We'd like to give the commissioners some heads up as to what the commission wants to look for so that they can be prepared to answer those. The second item under new business is submission of potential charter amendment topics. I had prepared, and the executive committee and staff reviewed a proposed form for submission of amendments, which includes who is submitted by, what date, a description of the amendment, a purpose and reason for it, and then charter select sections or county departments or agencies that would be affected. I don't think we need to vet the form here. If you have questions about the form or suggestions about other things that might want to be included, as you'll recall from our adoption of the rules, we agreed anybody can submit an agenda and a proposed amendment. We would have an initial discussion and presentation by that member and any members that want to comment on it. And then we would take a vote and determine whether or not it would proceed to full consideration. If I remember right, 9 votes would move an amendment to full consideration. I am hopeful, as I think some of you are, that we get to the amendment process sooner rather than later. So I think I'd like to have people start submitting their proposed amendments, and especially think about an August 1st deadline maybe, so we can get an initial wave in at least. We're not going to cut people off from future amendments, but I think the sooner we get an idea of what people want to discuss and have questions about, the better it can be. Vice Chair, okay.
Could you possibly flash a picture of that document up on the screens or on Zoom?
It would, I can't, but Linda
can.
may be able to pull that up.
And then can you share the source to find that document?
Okay. If I share the source, would you like Linda to send that back out, post it
Yeah.
on the website?
Just to make sure it's at fingertip.
Okay. Let me mention a couple other things while she's looking for that, and then that are just administrative matters. On August 25th, we had, on our tentative schedule, had the former county managers, Mike Press and Hannah Zacharias, presenting. Neither one of them are available on that date. So we don't have a specific agenda right now for August 25th. Our last presentation by county departments and agency will be our next meeting on July 25th. And then, whatever the date is, help me, Mr. McCune. I noticed on the agenda, it says the next meeting is Wednesday, Wednesday, July 28th. So it's July 28th is our meeting. That will be with presentations by budget, financial planning, election office, financial management and administration, treasury, taxation, and vehicles. And then we'll be ready for the county commissioners on August 9th. And we don't have an agenda for August 25th. The executive committee is going to get together and talk about that and give you some options, which might include no meeting. That's the end of the summer. It might be, we've been meeting every 2 weeks since the first week in April. Or we could move up the public hearing, or we could work something else into that agenda. One of the things that might be possible is to have County Manager Penny Post Oak Ferguson, the current manager, come back. She did our initial orientation, but come back and talk to us some more. And now we may have some other questions to ask her about structure. The last thing is, I don't want to talk about this here, but I'd like to know how the social media templates are being used that Linda is sending out. If people are truly using those and getting those on their Facebook pages or Twitter, then we want to continue it and do it as early as possible. If not, we'll probably send those out simply with the agenda, so we're not getting as many emails. So let Linda know if you are anxious and are using those social media templates that the county has provided for us. Are you able to find the document? Okay. On the screen, and presumably for those of you on Zoom, it's the format of the proposed amendment. Pretty simple. We've seen some of what was proposed in 2011. The idea here is to inform the commission about what the amendment is, why you think it would be a good idea or should be discussed. And I think it's important that we not just think that if somebody submits an amendment, they necessarily think it ought to be adopted, because we ought to be able to discuss amendments as well, and discuss how they might or might not affect the county, and then how it would affect various sections of the home rule charter as of today. So Linda, will you send that out again to the members and post that as one of the resources on the website? Yes. Okay, thank you. Any questions from the virtual participants or those in the room before we move into our first presentation?
Has Mr. Press or Mr. Zacharias indicated when they are available?
I don't know that we know that. I think we simply know that they aren't available on the 25th.
That's right.
So we'll check back with them. I do think everybody wanted to hear from the former county managers that had operated under the charter. So we will have them at some point. Good point. Okay, if Johnson County Developmental Supports is ready, Chad, we are ready for you if the technology is ready to go.
All right, thanks. I will try to share my screen here. Linda, I think I
Chad,
have
just
to-
1 second. Let me stop.
Gotcha.
Okay,
Right.
Chad, go ahead.
Thank you. Okay. First of all, I just want to mention my name is Chad Von Onen. I'm the Executive Director at Developmental Supports, and appreciate the opportunity to present to all of you this evening. So as I get arranged here, I hope that you all had a chance to watch the overview video of JCDS that we sent out prior to the meeting. Many times when we present, especially in some groups that aren't as familiar with what we do, we get a number of questions about what types of disabilities the people we work with have and what types of services we provide here at JCDS. And so the intent of that video, over the years, we decided to create that to just provide a high-level overview to different groups that we work with. I would also like to acknowledge on the call this afternoon, our Deputy Director, Shelley May, is on the Zoom, as well as a member of your Charter Commission, our Board Chair, Kyle Russell. So if there are questions about board structure that you want from the chairman's experience for JCDS, Kyle would be a good resource as well. So as you can see on the screen, our mission is to serve people with intellectual and developmental disabilities. And we do that by focusing on people's abilities, providing choice-driven supports, and advocating alongside people to live and work in our community. And then our vision statement is to aspire to build a community that promotes, supports, and embraces people of all abilities. I do want to pause a moment to talk a little bit about the mission statement. I think it's important to provide some context with what we do. 7 years ago, we reviewed the mission statement, the vision statement, and we did that with a group of people who receive services from us, stakeholders, and our staff. And I always think this is important because lots of times mission statements, I don't know, sometimes organizations don't really buy into them. For us, this has a lot of meaning. For the people we serve, the fact that we're looking always at the abilities that they have, the idea of choice-driven supports, that means they're the ones who are in control of their services. They can pick where they get their services from and what those look like. And then that last piece, I think, is especially strong, advocating alongside people. It was a theme that came throughout that we don't want you as our staff speaking for us. We want you to be alongside us and talking with us. So just think that's important to highlight, and I always like to call that out. So we're an agency of county government. We have a 7-member governing board. Each commissioner has a board member appointment. We have Kyle Russell, Debbie Scott Williams, Rick Marion, Gail Richardson, Mike Hughes, Dale Chapin, and Kiki Oyentunji. And this board structure is set under Kansas statute. It's the Chapter 19 for counties and county officers. And it's the same set of statutes for mental health centers and services. So when you hear from Johnson County Mental Health later, you'll see that they have an advisory board structure with the county commission as the governing board, but those are under the same set of statutes. So there are 2 primary functions we have at JCDS. One, we are the Community Developmental Disabilities Organization, or CDDO in short. That's an administrative function for access to and oversight of the home and community-based services in Johnson County. And when you hear the term home and community-based services, a lot of times what we're referring to are the services that are provided through the state of Kansas under a waiver from the Medicaid program to provide home and community-based services. So services in someone's home, it's not in an institution. So with that, our CDDO works very closely with the Kansas Department on Aging and Disability Services to manage our local service system here in Johnson County. JCDS is also one of 79 providers in Johnson County. So we provide a variety of services, as you see on the screen: targeted case management, residential, day and employment, health services, primarily to adults 18 and over. And these services are provided consistent with our mission. We focus on integration for the people we serve, independence, inclusion, and productivity are the main themes that we're looking for. In terms of overall numbers, there are a couple of key points I'd like to call out on this slide. First of all, just the overall numbers that you see under that blue box. There are 2 in particular. As you can see, there are just over 1,800 people in Johnson County who are receiving intellectual and developmental disability services. And then we have 831 people on the state's waiting list for services. So as of today, that waiting list for services is over 9 years long. Again, nearly 80 service providers of various sizes and offering different services to people in Johnson County. The JCDS service provider chart here shows a breakdown of services in yellow that we provide directly as a county agency. And some of these numbers, they won't add up. They can be duplicated. If you go back to that idea of choice-driven supports, think of it as kind of an a la carte approach to how people get their services. So a person may get their case management from JCDS and then choose their day in employment from one of those other 79 providers in Johnson County, for example. But in total number of people, JCDS supports 568 people across those services. The red boxes are there to highlight for you a little different structure that we see across the state of Kansas for intellectual and developmental disability services. So of that administrative CDDO function, there are 5 county-based CDDOs around the state out of 27. So of course, 27, if you do the math, many CDDOs are in multiple counties. And then in terms of the direct service provision, JCDS is the only county-based service provider in the state. It's a little bit of a snapshot of history and the reason why the county ultimately began offering services. You have to go back well before my time. In 1971, county passed a resolution to establish a mill levy for developmental disability services. And I think that I want to take a chance on this slide just to remind everyone the terminology, as you can see, in 1971 is not the same terminology we use now. This directly relates to the resolution, but we don't use the MR terminology anymore. We talk about intellectual and developmental disabilities. Then the next big structural change that happened statewide was in 1996, and that's the passage of the Developmental Disabilities Reform Act. And what the state was looking to do at that time was to say, as a state, we think it's valuable and important for us to move away from institutional-based settings and make sure that people can get their services in their community with their neighbors and with others, and provide them opportunities, as we talk about in our mission, to live and work in their own home communities. So again, if you go back to that structure I talked about earlier, 27 CDDOs, the counties had an opportunity with the state of Kansas to designate the CDDOs for their county. Johnson County, the CDD were only Johnson County. If you go to Western Kansas, you're going to see a large number of counties decided to partner with their neighbors in their CDDO to form their CDDO catchment areas. Okay, this slide's going to look a little bit busy, and there's a purpose for putting it on here. So I don't want you to get hung up on all the words. What this is trying to do is show the alignment between the county commission priorities, our governing board priorities, and then how staff implements that. So in our most recent JCDS governing board strategic planning retreat, we started with a focus of, let's look at our mission statement, and then let's look at what the county commission's priorities are on vulnerable populations and advancing self-sufficiency. And then that could drive the conversation for our governing board on what they felt our priorities should be as an agency. In the purple area, that's where the priority areas for the governing board came from. And they look at things like, when you think about external factors, threats, and preparedness, that's pretty much, well, the majority of things that we do are driven by state or federal regulation and policy. And so that's always something we have on our mind. What is happening at those levels that could change and affect how we provide service? That community needs and challenges, that's where the board was telling us, what else can we do for people on the waiting list? How do we know we've got a variety of service providers? How are we working with them and coordinating services? And then community education and public perception. That has a lot to do with outreach. Do people who need services know how to access them? From there, the orange and light blue shaded colored areas are what we took as staff to say, how do we operationalize some of this? So again, the purpose of this is just to show alignment. There's a lot of consistency, I would say, between what the county commission's priorities are and what our governing board priorities are. And then at the staff level, our job is to try to figure out a way to operationalize that. We use this to help guide our reporting to our board as well. So this is not something that's covered in the charter, but I wanted to make sure to mention it because it's very helpful in how we operate and function here. So Friends of JCDS is a separate nonprofit entity that was founded in 1990. And the purpose was to provide resources for people that where they weren't covered under their services. The story I've been told on this is that the inception had to do with the need for fundraising for art supplies. Well, Friends has expanded greatly from art supplies over the years and has become a much more active and critical partner in creating now barrier-free housing for people who get residential services from JCDS. The funding through Friends of JCDS comes primarily through fundraising and grants. We own right now 19 homes, 16 of those are in operation, 2 are being renovated. And 1 is being scheduled to build, but we're having a few delays due to the construction costs. And again, our mindset with these is to make sure that they're affordable and accessible. And they're recently, in the last 4 or 5 years, we've started to design all of the homes with age-related illnesses in mind. And the thinking behind that is we see a number of people who have early onset Alzheimer's or dementia, and we don't want a person to feel like they need to move from their home if those age-related illnesses start to come on. So the design elements now are set for people to be able to age in place. In terms of overall budget, This is our 2021 budget with just over 300 FTEs. The revenue is primarily a mix of those Medicaid billing revenues. That's in that agency revenues is primarily going to be Medicaid billing there. And then as you can see, local tax support makes up the balance of our budget. I do want to just take a moment to mention here in terms of those reimbursement rates. I think we had struggled for a while. Those rates are set by the state and they've been stagnant for many years, but we're very fortunate that the legislature has provided a series of increases in those rates. And also in terms of the waiting list, we'll be looking at waiting list options in the future. And also what's been interesting, I think maybe through the pandemic, some of our services have risen to the forefront more for policymakers. Federal government provided temporary enhancement to states, and state of Kansas is looking at using that temporary enhancement to focus on workforce recruitment and retention issues. And so with that in mind, if you look at the blue box below in terms of expenditures, over 80% of our budget is personnel. So our employees are clearly our most valuable asset. Direct support staff do amazing work. They work with people with complex needs on a daily basis. And just to give you an idea, they administer over 50,000 doses of medication a month. They work with people that could have high behavioral health needs, high medical needs. And again, going back to some of what we talked about earlier, all the while helping people live and work in the community is a priority area for us. So a few areas just to touch on as well, just the relationships with some other entities. We're accredited by the Council on Quality and Leadership. That's an international accreditation commission. And we recently made the change to go to CQL. And the reason for that was their focus on the accreditation process is on the outcomes for people. They want to look and make sure that if people are developing their service plans and outline their goals and priorities for themselves, that we as an agency are actually helping people get there. So it's a much different perspective from an accreditation process versus looking at policies and structure and those types of things that sometimes you see in accreditation. It's helpful for us. We're working towards aggregating those measures as we get more familiar with and embedded into CQL. And I think it'll be really helpful for us as an agency. Relationship with the state of Kansas also highlighted by, we're licensed by the state of Kansas, by the Kansas Department of Aging and Disability Services. We're a partner with vocational rehabilitation services. Employment services are a high priority for us. The pandemic had a definite impact on our ability to provide employment services, but those services have rebounded greatly. And to give you some idea, in terms of those employment services we have there, those are jobs where people are working competitively to try to obtain a job just like any one of us would do. And those jobs are integrated and again, through a competitive process. We also are actively involved with both our National Association Anchor and our State Association Interhab. And again, as I mentioned earlier, much of what we do is driven by state and federal policy. So those are important connections for us. In terms of the questions that we had in advance about the home rule charter and how that affects JCDS, I wanted to mention, I had a chance previous to coming to Johnson County, I worked for Sedgwick County, and their developmental disability services were structured under an advisory board structure with the county commission as the governing board. So I've now been with JCDS for 8 years and with the governing board structure. And I will say, I believe the structure works within the charter for us. There's alignment I mentioned earlier. And that alignment's not only with the county commission priorities. I will also say I've had a chance to watch some of the previous charter commission meetings, and the questions come up about how do you work with centralized HR, IT, fleet management. We're completely aligned with those and working within those as well with those centralized services. So there aren't really issues there. And with not intending to have a slight towards any of my previous advisory board members I worked with in Sedgwick County, I think the biggest difference for a governing board structure is the ownership that comes along with that role. Both structures allowed for people who had direct interaction with services to be on the boards. I think that's extremely helpful for us. But that ownership piece with the governing board structure, I think, is important. the other question about any changes that we would recommend, in my opinion, I don't have any recommended improvements. The changes within the charter that would help us meet our challenges. Again, I believe this is an effective model for us, and that's the extent of what I have this evening. I'd be glad to answer any questions that anyone might have.
Thank you, Chad. Questions for Chad. If you are on Zoom as a commission member, please just state your name, unmute and state your name and go ahead and ask your question. And why don't we start with the folks on Zoom and then we'll come back to those in the meeting live.
If I could make one statement, Brenda Sharp has entered the meeting. Thank you.
Chairman Musil, this is Joy Costin. I do have a quick question.
Go.
Okay, great, thanks. Chad, thanks so much for being here today. I've had the pleasure of visiting your organization a couple of times over the last few years, and I'm humbled by the work that you do. So every day I know the challenges that you face. You mentioned earlier that there is now a 9-year waiting list. It seems like that's gone up a bit since the last time we talked, and there are 831 people on that waiting list today. What is the biggest barrier to people being able to access the services that you offer?
So the challenge there is that's a statewide waiting list. So that's managed by KDADS. And so honestly, the biggest challenge is the cost of the services. So for someone, the last numbers I've seen is the cost of services for someone who's on that home and community-based services waiver. So if you think about this, that's a very comprehensive set of services, and it's around $50,000 a year. So statewide, the waiting list is, last I've seen, around 4,500 people. So you're starting to get over $200 million to bring everyone into this type of service structure. So the thing that we've made some progress on with the legislature this year, through our state association Interhab, is to work with the legislature on an interim committee to evaluate the waiting list. And I think this has generated some interest from legislators and from KDADS. And I think it's an opportunity for us to look at, do we need just this one comprehensive set of services, or can we do things like enhance, as I mentioned earlier, enhance some of the employment programs, for example? Might not work for everybody, but it could start to piece out some of those options that people are looking for. Another good example is for children in services and maybe having like respite care type of options for them and expanding some of those things. So again, I've been really optimistic about the progress that's been made, and I'm hoping we can continue that.
And so is the 831 number, that is specific to Johnson County?
Correct. Yeah, out of the state total.
Okay, out of the 4,500.
Yeah.
All right. Thank you. Keep up the good work. I know how challenging it is.
Thank you.
Other questions from commissioners? Anyone here in the room? You did a very comprehensive job, Chad.
Thank you very much. Appreciate the opportunity.
Thank you very much for your time and for your service. We now have your presentation and know how to reach you. And sometimes there are questions that are submitted to presenters after the meeting that will be forwarded to you by Linda. Thank you very much.
Thank you.
The next department agency on our list is the Aging and Human Services with Deborah Collins.
Yes, good afternoon. Can everybody hear me okay? Okay.
Yes, we can in the room.
Okay, so I'm Debbie Collins. I am the director of the Aging and Human Services Department. And with me is Megan Leahy. She is our director of administration and outreach services. So she's kind of here to help me keep things on track in case I stray. Just by way of introduction, just wanted to let you all know that I'm no newbie to the county. I have been with Johnson County for 36 years now. The first 21, I was in Chad's shop before Chad was there. So Spent the first 21 years of my career with the Developmental Supports Department, and then the last 15 have been as the director of the Aging and Human Services Department. And it's truly been the honor of a lifetime to have been able to serve in this capacity. So thank you very much for having me, and thank you all for taking the time to be here. So Linda, go ahead to the next slide, or Jody or whoever's running it for me. So the mission of Aging and Human Services is to provide essential human services as a safety net for senior adults, people with a disability, and low-income families in order to support their independence, dignity, and self-sufficiency. Next slide. We have two divisions in the Aging and Human Services Department. We are the Area Agency on Aging, and we also have an outreach services program. Next slide. So just some general information here. I was told that you had some questions that you wanted specifically answered regarding, whether or not the existing home rule charter is efficient and adequate for the needs of our department. And I would say that yes, it is. We would not have any recommendations to make in terms of a big change in the charter regarding our department. So it does seem to be very efficient, and it's meeting our needs. Likewise, the directorship role, I was asked to address, what my authority and accountability is. And I'm quite sure you've probably heard this from other people, but I have the exact same role, authority, and accountability structure as all of the other appointed department heads do. Some of the directors that have governing boards have a different structure, but I'm actually in the same boat as the other folks that you have already talked to. So unless there is a specific question about that, I was just going to mention that, I'm nothing special in terms of the county as far as my accountability goes. I have high accountability expectations, and just as all the other appointed department heads do. And I actually report to the assistant county manager. So Joe Connor, which I'm sure you probably have met, he is actually my direct supervisor. Also wanted to mention that the Aging and Human Services trend over the past 15 years has really been to move toward more direct service to vulnerable populations. We have actually relegated some of the things that we used to do to the private sector. And I mentioned that because I wanted to be very clear that, we're really serious about providing direct services, and that we have tried very hard to be very good stewards of county dollars and taxpayer dollars. There are things that were in this department when I first started 15 years ago that had been around for a while, that we really looked at and determined that that there was sufficient resources in the community to actually be able to, we could actually stop doing some things because the private sector was doing them as well. One example of that is sign language interpreting. We used to have a whole department or a whole division in our department full of people who were very well versed in sign language interpreting, and they would go and interpret for all of the court cases that needed sign language interpreting, for any other county departments where there were employees or clients who needed sign language interpreting. And that was really very, very important back in the day, back before the private sector actually came forward and developed a lot of interpreting services. So once we realized that we were kind of duplicating that service that the private sector was doing, then we were able to kind of do away with the sign language interpreting. And there are some other things that I could give you examples of, but I won't spend a lot of time on that. I just really wanted to make the point that we have worked very hard to try to get our services down to the most, most efficient way that we can. We try to use our resources as efficiently as possible in direct service to vulnerable populations, because those populations are continuing to grow. And I also wanted to mention that from the 1980s until last year, the housing programs were also located in our department. Last year, the Board of County Commissioners made the decision to move housing into the planning department. And I'm not sure if you've already spoken with planning or not, so you may already know this, but the purpose was so that we could have a more focused emphasis on our aging programs. You are probably not going to be shocked when I tell you that the aging population is growing by leaps and bounds in Johnson County. In fact, 27% of our population right now, which equates to about almost 166,000 people in Johnson County, are actually people aged 60 or better. And you notice I say better because, you know, it is better. So we are continuing to grow, and we really needed to be able to have a really laser focus on those aging programs and be as nimble as possible. So that was part of why the decision was made to move housing into planning last year. Next slide. This is some budget information. Our total budget for our department is about $8.8 million. And you can see that 44% of that comes from county general fund. So local county tax dollars, 44% of our budget is supports this department. 33% is funded by grants, and those two grants in particular, we have Older Americans Act funding and we have Senior Care Act funding, and those are federal and state funded sources. And then we have a certain level of fees that come in at 14%. 4% of our budget are contributions and donations. And then we have some other miscellaneous things, intra-fund transfers and miscellaneous, very small portion of our budget. We have about 62 full-time equivalents in this department. Next slide. So we'll just move right on into the Area Agency on Aging. This entity is actually responsible for planning and implementing community-based services for adults age 60 and better. The AAA is a federal designation. It comes through the state of Kansas, from the federal government to the state of Kansas. This is a statutorily prescribed entity by the Older Americans Act. So by virtue of us receiving Older Americans Act funding, we are a designated area agency on aging. Just a little bit of background there. There are 11 AAAs in the state of Kansas. They have both nonprofit and some of them are sponsored by county government. There are 3 of the 11 are either kind of quasi-governmental or are full-blown county government entities, such as the one in Johnson County. The rest of them are nonprofits, and the act does not designate which direction you have to go. So nationwide, there's a full array of different levels of, or different types of support of AAAs. Part of the Older Americans Act also says that we are required to establish a commission on aging, and that is an advocacy and advisory group that is actually appointed by the Board of County Commissioners. So we have a very, very active Commission on Aging. They provide a lot of advice to us about what they believe older adults in Johnson County are needing and what they're seeing and what they're hearing. And they also act as a really great advocacy group. They spend a lot of time in Topeka and talking with legislators on our behalf. And they've, again, just a very, very active group of folks, and we're pleased to have them associated with us. I've already mentioned that the AAA is funded largely by grant funding, and that is mostly through the Older Americans Act and Senior Care Act programs. And Johnson County has supported the AAA in county government since 1979. Next slide. Some of the services that are provided by the AAA include information and assistance. We have a variety of different directories, brochures, fact sheets. Some of you have probably seen the Best Times little news magazine that is not actually produced in our department any longer. It used to be, but it is now over in the PIO office. So all of that, you know, we are able to hook you up with those kinds of information. We also can provide in-home services for people who are attempting to remain living in their own homes free of nursing home placement. So with housekeeping, attendant care, bath aids, medication aids, respite care for to give families who may be the primary caregiver of folks, to give them kind of a break. All of those services help to keep older adults living in their own homes at their highest level of personal independence possible, and preventing them from having to enter a nursing home. But for those services, they very well may be in nursing homes. We also provide caregiving support and counseling. And then a large portion of what we do is through what is called the Aging and Disability Resource Center, or the ADRC, which is kind of the front door into the nursing home industry for anybody who is on Medicaid. We actually do, you see the very bottom bullet says care screenings for nursing home care. Those are screens that we provide and assessments that we provide for people who are on Medicaid that are contemplating nursing home placement. And so our case managers, our social workers, either go into their homes, and prior to COVID, they were going into their homes. Now they're doing a lot of the screenings remotely through the phone and Skype and through other means. But we are able to determine whether or not they are capable with an adequate amount of in-home services, if we can keep them living in their home, or if they are to the point where they really require more around-the-clock nursing care. But our ADRC staff are the ones that make that determination. We also do options counseling on Medicaid and other types of benefits, and we provide assessments not just for people who are older, but also people who are disabled and who have traumatic brain injuries. So next slide. One of the largest programs in the AAA is our nutrition service. Most of you are probably familiar with the term Meals on Wheels. We actually do have a home delivered meal program. We don't call it Meals on Wheels anymore because that is a proprietary name for a national organization, and we don't receive any funding from them, and we don't pay them to use their name or any of their information. So we have what we call the home delivered meal program, and this is for anybody that is age 60 or above who is homebound and cannot get out of their home, to go get nutritious meals. So we serve about 600 meals a day in that program, and we rely very heavily upon volunteers to deliver those meals for us. We'll talk a little bit more about that in just a minute. We also have the more traditional neighborhood nutrition centers, also known as congregate meal sites. We have several of them scattered across the county. Those are just now starting to reopen after COVID, but that is a place mostly in community centers or senior centers where people who are 60 or older can go and have a meal with their friends. They can socialize. We do try to provide some entertainment, that give them an opportunity to play cards together, or some ladies like to quilt together, those kinds of things. There's all sorts of different activities at those congregate meal sites, but that is a much smaller program than either our home delivered meal program or the next program, which is our CHAMPS program. CHAMPS stands for Choosing Healthy Appetizing Meal Plan Solutions for Seniors. And that's a mouthful, so we just say CHAMPS. But that is actually a really great partnership with the Hy-Vee grocery stores. We have partnered with Hy-Vee to allow people who are 60 or above to come in. We give them like a little debit card, and we load a certain number of meals on the debit card, and then they can go to any Hy-Vee that participates with us, and most of them in Johnson County do. But they can go and they swipe their debit card, and they're able to get a meal, either breakfast, lunch, or dinner, from the food court at Hy-Vee. There are some restrictions. They can't have, like the Chinese food. It's a little too high in sodium, but we do have to, we require that they have certain nutritional guidelines that have to be followed. But that program has just been wildly popular. We have about close to 2,000 people that participate with us in that program. And I want to brag here just for a moment, but this program was actually started here in Johnson County, and it's won several national awards, and it has actually been replicated many places across the country. So if you ever go to another community and you hear about the CHAMPS program, you should know and be very proud of the fact that that started right here in Johnson County, Kansas. Very, very popular and important program, way that we can get healthy meals, ensure that seniors are getting access to a healthy meal. Next slide. And then finally, we do offer some community-based services. Legal assistance is provided through a partnership with Kansas Legal Services. And then we can provide some consumer advocacy, again, mostly through legal channels. There are certain things that we've been asked to help with, and we're able to provide mostly referrals to Kansas Legal Services for some advocacy work. Next slide. Now we'll move on to our outreach services and outreach partners with our community. Our goal is to bring services to the neighborhood level and to add to the overall quality of life and independence and self-sufficiency for low-income residents. Our community partnerships are really what makes this work. We're just one cog in the big wheel that is the Human Service Network in Johnson County. And we partner with, these are just some of the people that we partner with, Kansas City's Medicine Cabinet, Catholic Charities, Salvation Army, a lot of different faith-based organizations and school districts. We work very closely with a lot of the school districts as well. We have 4 multi-service centers, one in Gardner, Lenexa, Mission, and Olathe. Next slide. So just in our multi-service centers, we provide stabilization services. But for just a moment, I wanted to talk to you just for a bit about poverty in Johnson County. Okay. So there are really 3 different types of poverty, and we see people in our multi-service centers that are in each of these categories. Generational poverty, of course, is where at least 2 generations have been born into poverty. And we do serve people that are in that category. Then there's situational poverty, which is what we have seen an awful lot of, especially during the pandemic. This is when a crisis occurs in a household, medical expense, an injury, a death, a divorce, job loss, reduction in hours. You can imagine during the pandemic that we saw a lot of people who had never had to come to us before and that were needing some help with food pantry or help to pay utility bills because they've lost their job or their hours were significantly cut back. So we see a lot of folks in that category. And then our fixed income category, these are people who live on, as it says, on a fixed income, mostly Social Security or disability payments. About 1/3 of the people that we see fall into this category. And most of those folks are older and or disabled. So I like to always kind of point that out that, kind of to try to bust the myth of poverty, that it's not just people who are, traditional welfare folks. It's a lot of older adults. And I think that that's really important that you all understand that and that our community understands that many of our older, seniors that have actually been the ones who helped build this county are living kind of at or near that poverty level. So we do everything we can to try to help them with their expenses as we're able. And just some numbers, 80,782 residents in Johnson County live at 200% of the federal poverty level. And that's an important number because that is what we serve people up to 200% of the federal poverty level. 31,000, almost 32,000 residents live at 100% of the federal poverty level. And just another statistic, 1 in 5 school children are on free and reduced lunch programs. Next slide. So in our multi-service centers, like I said, we provide stabilization assistance. Utility assistance is really kind of our flagship service. We provide a lot of help with people that are struggling to pay utility bills. And especially during the pandemic, now that all of the moratoriums have been cut off from, that now Evergy and other energy companies are able to actually do shutoffs of utilities. During the pandemic, they were not doing shutoffs. But now that they are doing that, we are seeing people with huge utility bills to the point to where we're not able to help very adequately. The other day we had a person come in that had a $3,600 light bill and had not been able to make any payments on it. And we have a very limited amount of funding, usually about $350 is what we're able to help households with. And at that rate, it wasn't enough to avoid the shutoff. So we weren't really able to do anything to help that family. And we're starting to see more and more of that. So we're working on some ideas about how we might be able to kind of cobble together some more funding to help these folks who are really struggling with these high utility bills. We also have food pantries in 3 of our 4 centers. So people that are struggling with food insecurity might need some help, with some basic food pantry items. We're able to do that. We have some rent assistance, but it's pretty limited again, that we're able to provide. And then again, our partnership with the Kansas City Medicine Cabinet vouchers allows us to provide eyeglasses, hearing aids, prescription drugs, other medical equipment, and dental emergencies for some of the people that we see. We also do some short-term goal planning and case management, and we offer a lot in the way of information, referrals, and resources. Next slide. Just so that you have kind of a reference about the poverty level, I referenced 200% of poverty being the threshold where we can serve people up to that. If you'll just look, like for instance, a family of 4, 100% of poverty, their income level would be $26,500. That's 100% of poverty. If you'll scroll over to the right, you'll see that 200% is $53,000. And so we are able to serve a family of 4 at that income level. If they come in over that, there's not usually much that we're able to help with, but we do try to provide referrals and other resources for people. Next slide. And then 2 other programs in our outreach services are our Catch a Ride program. That is a volunteer transportation program made up exclusively of volunteer drivers, and they will help us to provide rides for people that don't have transportation, mostly to medical appointments. That is the biggest bulk of what we do. We do have people who have dialysis and chemotherapy appointments, so we're able to get them through this program. With volunteers, we're able to get them to their appointments. We also can take people to food pantries and other social service agencies, for example, the Housing Authority. We're not able to provide rides for like hair appointments, shopping, at malls and things like that, because we just simply have too much demand in our medical appointments. There's so much need there and we have such a limited number of drivers that we're not able to expand beyond these actual essential rides. Excuse me. The people that we see primarily in the Catch a Ride program are Johnson County residents who are 60 or better, people who have a physical disability at any age, or people who are in a life transition and do not drive for whatever reason. And then we have an accessibility program. So this is for anybody who is under the age of 60 who would be homebound and has a documented physical disability. So we can provide homemaker services, home delivered meals, some kind of custom care and case management to those people. Next slide. I would be absolutely remiss, and my volunteer coordinator would be very upset if I didn't throw this slide in. So this is just some ways that people can get involved with our department. We are always looking for volunteers for our home delivered meal program. We are always looking for more drivers for Catch a Ride. So if you are so inclined or interested in ever helping out with either of those programs, we would love to hear from you, or spread the word amongst your neighbors and friends, and let them know that we're always on the lookout for good volunteers. Next slide. And then finally, another way to be involved is by hosting a food or hygiene drive for our food pantries. We have an Amazon wish list as well that makes it it's very, very easy to donate that way. You just go on Amazon and you would look up Aging and Human Services wish list, I think is what you would, anyway, you would find Johnson County Aging and Human Services and it will pull our wish list up. And so you just have to click, click, click and pay for it. And we will get whatever it is that you purchase and send it right to us. So again, spread the word on that. We would love to have your support that way. And of course, monetary donations are always welcome as well. Our Catch a Ride clients and our home delivered meals clients actually do provide donations to kind of help offset the cost, which is greatly very helpful for our budget. And then we do have a very small 501c3 called Community and Family Support Services that is affiliated with our department so that we can actually provide an avenue for people to make cash donations to us. Next slide. We're also out there on social media. We have Facebook, Twitter, and YouTube sites. So just look for Johnson County Aging and Human Services or these Twitter handles, or you can look us up on Facebook as well. We're always looking for more supporters. Next slide. This is just contact information for me. And then we have numbers for the AAA and outreach services. So if you have any, if you need to send somebody to us, feel free to do that. And that is my presentation. It looks like I have at least one question. Do you want me to go ahead and?
Thank you, Debbie. Yes, if there's somebody with their hand up.
Yeah, Brenda.
Go ahead, Brenda Sharp.
Hi, thank you, Mr. Chair. Debbie, thanks for that presentation. It's my understanding, I think, that the administration in Kansas just made some changes to asset limits for seniors. Is that correct, for eligibility for Medicaid? Is that going to impact our client base or your services in any way?
I have not heard that it's going to have any impact on us, but that's certainly something that I'll follow up with and get back to you on.
I presume it's good news that more assets will be protected now.
Yeah,
so that the spend down isn't quite as bad as it was, but I would like some more information about that and if that might have any impact on this particular department for the county.
I'll be glad to get back to you on that. But yeah, there's no negative impact as far as we have heard so far, but you never know.
Thank you.
Debbie, if you would get any responses back to Linda, then she will share them with the entire commission.
I'll be
Other
happy to do
questions for Debbie?
Chairman, I have a question. This is Joy Costin again. Debbie, thanks for your presentation. I don't think I heard this, so you can correct me if I'm wrong, but you said that 27% of residents in Johnson County are 60 years and better. What is the total population that you serve? What's the number approximately?
Well, it's kind of hard to put an exact number on that, but we serve about 10 to 11,000 people every year in one capacity or another in the aging program.
Okay, thank you.
And a lot of those are people who are calling into our information lines, just trying to get information about various different services out there.
Okay, thank you very much.
Dawn?
Just comparing and contrasting, I see that Johnson County Developmental Supports has a governing board that is set up via a statute, but there's no governing board for the area. Do you feel that there's a need for one as the population ages and continues to grow? Would that be help or unnecessary?
Again, I've worked for JCDS, so I'm very familiar with governing boards, and they can be very, very helpful at times. I feel like our Commission on Aging probably is adequate for what we need. They've been very, very helpful and really active with us. They are not a governing body though. So I feel like sometimes, there's already a lot of restrictions on what we can and can't do just by virtue of being part of county government. Having a governing board sometimes muddies that up a little bit, but not usually in a bad way. But I would say that that's not something that we would necessarily be advocating for or looking for. Certainly something that we'd be willing to talk with folks about if that feels like it's something that that would be appropriate.
Other questions? If you're on Zoom, just go ahead and unmute and state your name. It looks like the questions have been answered, Debbie. Again, you may get some other ones through email from Linda Sater. Much appreciate your time and what you and your folks do with the agency. Thank you very much.
Appreciate it.
Our next agency is Johnson County Mental Health. Tim DeWeese is going to make the presentation. We will switch over to Tim. Welcome.
Thank you again. Linda, are you running my slideshow or am I?
Would you like to run it or?
Oh, no, you're good to go. That's perfect.
Okay, go ahead, Jody. Thank you.
Thank you. Thank you, Jody.
I also would like to state that Karen Brownlee came into the meeting here in person at 4:44 p.m. Thank you.
So again, my name's Tim DeWeese and I am the director of Johnson County Mental Health Center. I've been in the position of the director since October of 2014. However, I've been a part of Johnson County government and the Community Mental Health Center for the last 26 years plus. And so what I'd like to do is share with you a little bit about what the Mental Health Center does and how we operate. So Johnson County Mental Health Center is one of 26 community mental health centers in the state of Kansas. Our focus and commitment is to build a healthy community through excellence in community mental health. We are CARF accredited, which is the Commission of Accreditation and Rehabilitative Facilities, which is something that we just recently had 3 years ago. We got our first accreditation for 3 years, which is the maximum, and will come again in 2022 for to be reaccredited. So we're pleased with that accreditation. Next slide, please. One of the things that I mentioned is that we are a community mental health center licensed by the state of Kansas. Johnson County, the Johnson County Board of County Commissioners established Johnson County Mental Health Center in 1962 as at a recommendation of the League of Women Voters, and it was as a provision of the Community Mental Health Centers Act of 1961. And so the mental health system, the Mental Health Center, has a long history with Johnson County Mental Health. And we have, as a community, which is one reason that drew me to Johnson County, as a community, we have a definite commitment to ensuring that individuals that have mental health issues are provided the right level of care and provided the right level of service that they need. We are currently today a Department of County Government. I report technically to the Board of County Commissioners. They represent my governing board, or they serve as my governing board. I also have an appointed advisory board that meets every other month as well. And on day-to-day operations, I directly report to the Assistant County Manager, Joe Connor. We provide services to roughly 10,000 Johnson County residents on an annual basis. And then we provide another 7,100 Johnson County residents with crisis services. So if you think about the 10,000 residents, are those 10,000 residents that actually become mental health center clients. The other 7,100 individuals are individuals that we interact with who are experiencing some sort of mental health emergency, but ultimately don't become a client of the mental health center. The mental health center budget is roughly $36 million. We have 350 total FTEs, which is still about 76 fewer than we had in 2008. So we are slowly building back up over the last several years. We have a variety of funding streams. We, of course, get county tax support, which roughly represents 60% of our budget. We receive state and federal funds, fee-for-service revenue or insurance payments. We receive grants, and then we also receive municipal funds from the municipalities here in Johnson County. Next slide. Our primary role is threefold. First, we serve as the local mental health authority to provide publicly funded community mental health services. Second, we serve as the community safety net for mental health needs within our community. And third, we serve as the gatekeeper to the state hospital, which is for us is in Osawatomie, Kansas. Who we serve, we primarily, and our primary focus is those adults who have a serious mental illness, those children who have a severe emotional disturbance, or any Johnson County resident that has an SMI or SED who also has a co-occurring substance abuse disorder. Finally, we serve any Johnson County resident who's in crisis or who's experiencing an acute psychological distress that may result in more intensive services like hospitalization or maybe incarceration. Next slide, please. So we provide those services through what I refer to as our 5 core divisions. And then we have a division that's really our support division. And so I'll walk through each of these divisions briefly. Our emergency services division provides emergency services, like I said, to anyone in Johnson County that's needing support, who's at risk of hospitalization or who's having a mental health crisis. That consists, our emergency services consists of our 24-hour-a-day crisis line. We operate that crisis line 24 hours a day, 7 days a week, 365 days a year. And we are in the process of becoming part of the National Suicide Prevention Hotline. So we'll receive those calls as well from Johnson County residents. We also have our children and family services and our adult services. So I won't go into specifically all the services that they provide, but primarily those services are broken out and provided by teams. Each team serves roughly about 125 to 150 individuals. And those services are primarily provided in the community. So primarily where people live, work, and play. And we do provide services at the center, but in order for us to help people recover and provide services that are meaningful in their lives, many times and most often, we have to provide those where folks are, and that's in the community. Finally, we have, or not finally, fourth, we have addiction and rehab, our residential services. We operate a 10-bed adolescent center for treatment, as well as an adult detox unit and a crisis stabilization unit that we use as an alternative of hospitalization, or we can actually use that facility as a step down from psychiatric hospitalization. And then finally, when I became the director, I added a prevention services division. And that's primarily because I believe, and the research is clear, that major mental illnesses and their devastating impacts are completely preventable. But what we have to do is begin to move upstream. The way that we move upstream is by educating our community on mental illness, destigmatizing mental illness, making it no different than a physical health care disorder, so that we could treat schizophrenia no different than we would look at diabetes or hypertension. Additionally, we need to look at how we can move upstream to provide prophylactic measures to individuals that are having or experiencing mental health conditions early in their life. One of the statistics that I like to share most often is that when a person experiences their first onset of symptoms, it is on average 8 to 10 years before they actually receive services. And so what we need to do within that prevention services is really move upstream and be able to have people access services at the time that they need that. And we've continued to work throughout the last 6 years as we have begun to look at how we can provide more quick, expedient access to individuals that are needing services right then and there. We also then have our operations division, which supports the mental health center, our medical division, which provides medication services, and as well as something called our health integration services. One of the things that we have found is that it doesn't do us really any good to help someone manage their symptoms of schizophrenia if they walk out the door and die of a heart attack. And so what we want to make sure is that not only are we looking at providing people mental health services, but we also want to have people live just in general more healthy lives. So really focus on mental health and mental wellness across the board. Next slide, please. So we look at, I wanted to share this slide because really its focus is on our strategic vision. And our strategic vision is based within these 7 areas. And those 7 areas really drive the mission and efforts of the Mental Health Center. And they are consistent and folded into those priorities that are identified by the Board of County Commissioners. And so we first looking to strengthen our financial position, so diversify our funding streams. We want to make sure that we have a unified treatment approach with individuals and focus on quality of care so that we focus on access, quality care, and cost containment. And our belief is that if you focus on providing services, access, when people need them, you do them in a quality way, then you contain costs across the system. Nowhere is that more evident than our co-responder program, which is our program where we embed social workers within the police departments. That provides immediate access. And what we see is by providing that immediate access and doing that in a quality way, we provide, or we actually see cost containment in a number of different areas outside of the mental health center, within ERs, within the jail, and within our city governments and their police departments. Third, we want to enhance our client satisfaction and engagement. One of the things that we want to look at is if someone is what we historically would have called treatment resistant, we want to look at what we are doing to engage those individuals into service. Our belief is that if you're providing something of value to someone, they will be engaged. And so if we have people that aren't engaged, we really need to look at what we're doing internally to be able to engage that individual. Fourth, we need to continue to build stronger community partnerships. If you look at the occurrence of major mental illness in the United States, that's roughly about 2 to 3% of the population. If you look at what that means for Johnson County, that's 118,000 residents of our community that at any point in time needs community mental health or mental health services. And so in order for us to meet that large demand, we have to build better, stronger community partnerships so that together as a community, we can serve those individuals that need our treatment. We also want to capitalize on technology. We want to make data-informed decisions. So looking at the data to tell us where we need to target our precious resources. We do have a limited amount of resources, but by looking at maximizing data and looking at the information, we can make good informed decisions about where we can make the biggest impact with those limited resources. And finally, the last area is in workforce, ensuring that we have improved staff satisfaction and appreciation, and that we continue to work on the workforce issues that we see here at the Community Mental Health Center. So overall, I think the questions that we had were to present to the commission and provide any recommendations. At this point, one of the things that I have experienced as a mental health center employee over the years is we were an agency of county government. Today, we are a department of county government. And quite frankly, both of those work very well. I'm pleased with the structure that we have right now. I believe for us at the Mental Health Center, it's provided us some unique opportunities and also allowed us to be much more collaborative in nature with many other departments across the mental health or across the county. So not only do we have robust relationships with Johnson County Developmental Supports, but we continue to look at how we can continue to provide services with our public health department, as well as our human services and aging department and our planning department in regards to housing. specifically also within our transportation department and how we can provide transportation to ensure that people get to the services and have access to care that they need. And with that, I will stand for questions.
Thank you, Tim. You may remain seated for questions, but I appreciate that you're available for questions. I know what you mean.
Thank you.
Questions for Tim, either in the room or on Zoom. Again, unmute and state your name and ask Tim your question.
Paula
This is
Swaff.
Go ahead, Paula.
my question for Mr. DeWeese is this. We've heard from disparate departments about the need for additional mental health and substance abuse screening and treatment. I would include amongst those the sheriff's office, the corrections department, the county prosecutor's department. So is this supported by the data and information you just spoke about? And if so, what can we do to assist in addressing that need?
Yes, absolutely. The data certainly bears that out. And if you look at where the growth within the mental health center in regards to additions that have been made to personnel FTE wise, they've been in those specific areas. Recently, at the start of the pandemic, 2020, we started providing all of the mental health services in the jail. And we're providing what we call a brief jail mental health screen for every individual that is booked into the jail. That's roughly about 14 to 15,000 people annually. And then we do what we call assertive outreach for those individuals. And we are in the process of finishing some data that we have worked with the University of Notre Dame in looking at the impact that we've had. And what we're seeing from that information is that we have truly made a impact in the recidivism rate. And so one of the things that I mentioned early on was that if we provide access to care, we do it in a quality way, we contain costs. We see that time after time within the corrections system, within the sheriff's department, within the and within our co-responders. So more than ever within the last, I would say the last 6 to 7 years, we have developed much better relationships. They have all been supported by the county. And fortunately, I believe that the state of Kansas is now seeing the importance of that and are continuing to look at how they can support those expansions as well. So from my standpoint, from this commission is just to understand that no different than public health. Well, I'll just say this. Mental health is public health is mental health. And so from the standpoint of this commission is that as we begin to talk about making sure that our community is healthy, that mental health needs to play a vital role in that. And I have no doubt that that will be the case based upon the history of this community and the history of this county and the leadership within this county, that will happen. That was a long answer to your question, sorry.
Other questions?
Chairman, this is Joy Cosin again. I have a question. Tim, it's good to see you. Thank you for all of the work that you do. As someone who has had a loved one who struggled with mental illness for over 10 years, I can tell you that this is certainly an important topic and one near and dear to my heart. I will also say that the same person is now celebrating 9 years of recovery. So it is possible if you can get the services you need to find a path forward. So I'm very happy with the work that you are doing and very excited of the collaboration that you work with. I know with the corrections department as well as other agencies. So thank you. Can you tell me though, what is the current wait time for individuals who might call your agency and need to either see a therapist or get into a hospital or for a psychiatric inpatient service? What currently are people looking at right now?
So for individual appointments, so for someone that calls and asks for assistance, we have same day access. So someone can be seen same day. If they call, we can ask them what time they want to be. So we have what we call an open access model which is something that I implemented when I started, because I really never understood how someone could develop the courage to ask for help. And then we say, come and see us in 7 days. So we created an open access model. We're actually able to even see people with a psychiatrist the same day if that's warranted. Sometimes it makes sense to do that. Sometimes it makes sense to wait a week or so to get a full idea of what's going on. But that's outpatient services. When it comes to an individual that needs psychiatric services inpatient, that's where there's an issue. And the issue isn't specific to this community. The issue is specific to the state. And the access, what we see is that we have very limited access to state hospital beds. We have very limited access to community hospital beds. And so that wait time right now can be to the state hospital anywhere from 1 to 9 days. And so to give you an idea of what that looks like, an individual who may be experiencing some sort of symptoms of a mental illness, a serious mental illness, who may be at risk of harming themselves or some other people, they go to the ER, they're determined that they're needing to be in a mental health facility. We do an assessment. We look to the DA to file a care and treatment statute, and then we could actually see that person boarded in the ER anywhere from 1 to 9 days before they are able to get into a bed at Osawatomie State Hospital. The other thing is that not many hospitals, there are no other hospitals that will take involuntary commitments. So they'll take voluntary commitments, but there's very few, very few situations where we can get an involuntary patient a bed at a local hospital. So the only option is for us to go to the state hospital. So that is something that has been problematic for the last 10 years. It continues to be problematic. My understanding is that the moratorium will be on the state hospital will be lifted at the end of this year, and that they will return to their original 206 capacity at the end of this year. So we'll just have to wait and see if that happens. But right now, people that need inpatient treatment do not have access to that treatment.
Very good. Thank you, Tim. I appreciate your work.
Thank you.
Other questions? We have one more presentation today. If there's another question for Tim?
I have a brief question, Mr. Chairman.
Sure.
It's Chris
Chris.
Eiliff. Tim, your slides don't mention something that used to be called community support services. This was a part of the organization a number of years back that was provided, I thought, just critical care for very seriously mentally ill people who are suffering from schizophrenia and other things like that, but they didn't have to be hospitalized because the county would provide them with an apartment or a place where they could be checked on regularly and make sure that their meds were monitored. Is something like that still in existence?
Absolutely. So I was the CSS director for roughly 12 years before I became the clinical director and then now the director. So right now, as it stands, when I refer to adult services, that is our CSS program. And for those of you that may be familiar with Family Focus or CBS services, which is the same kind of concept on the kids side, that is our children and family services. So those are the focus. That's our primary focus. Individuals that are needing outpatient therapy, those are the folks that we are trying to connect with our providers that exist in our community. There's no reason for us to be in competition to provide outpatient therapy. So over the course of the last 6 years, we have primarily focused our energy and our resources on those individuals that have the most severe and persistent mental illnesses. And so for a lack of a better term, all of our adult services are CSS services.
Okay. Thanks. There's change in terminology, and I just wanted to make sure that it still existed because I, once upon a time, had a client that was very well served by that organization, by that
Absolutely.
unit.
Absolutely.
Tim, this is Greg Musil. One of the things that Paula asked you about, and we've heard a lot of collaboration from our first presentations with the district attorney, the sheriff, and the chief judge. Are there any setting aside the money issues, are there any structural barriers in the current home rule charter that you think make your job harder?
No, I don't believe that there are any structural issues in the current charter that precludes us from doing anything that we want to do. I think any of the barriers that do exist really have to do more with state statute issues. And so those are the things that we probably need to spend more of our energy on, focusing on those in regards to courts and mental health services. So from my standpoint, I don't have any recommendations or any changes that I would want to make, other than just to say how important mental health is to the overall wellness of our community. And I think that everyone pretty much knows that right now.
Okay. Maybe one more quick question. Karen Brownlee.
Thank you, Mr. Chair. I think Tim mentioned that his work in providing mental health services in the jail does impact the recidivism rate, but I don't think I heard what the numbers were. Is there data that he could share with us?
Absolutely. I will make there's actually just a 2-page brief that the University of Notre Dame just released on that very thing in regards to those total numbers. So I will send that to Linda so that she can send it out to the commission.
Thank you.
You're welcome.
Thank you, Karen. Thank you, Tim. We're going to go ahead and move on now. If other members of the commission had questions, obviously, again, send them to Linda and she will get them to Tim for him to answer for the entire commission. Thank you again for your time. Our final presenter today is Samuel Areola of the Health and Environment Department of Johnson County. Sammy?
Yes, thank you. Good afternoon, Chairman and Commission members. Jody, thank you. If you just go ahead and control the PowerPoint for me, that would be great. I have with me here our new Deputy Director, Charlie Hunt, joined us about 4 weeks ago. And so I've got a few slides. In general, I would just spend a few minutes talking about public health. And it's pretty good that Tim went just before me, and his statement, I think it's a good starting point that mental health is public health and public health is mental health. It is literally impossible to be healthy if you're not mentally healthy, physically healthy. They're all interconnected. And so the goal of improving health in our county is one that we have to intentionally define very broadly. Health is very broad. The things that Debbie talked about provision of human services, all of those impact health. The Department of Health and Environment is not just simply a place to come in and get your immunizations and WIC and deal with STDs. Those are still things that we do, but we're involved in several things. I think the biggest part of that is to understand that what you are doing today, the policies that we make, decisions that we make, all of those impacted. Next slide. And so in terms of our mission, it is to protect the health and environment, to prevent disease and promote wellness. And I think what I really want to focus on is the all, which is typically where there are gaps, not just in our county, but across the country. It is the truth is we are healthy when we are all healthy. And quite often we do our best, but we really fall short in areas, largely in ensuring that we build bridges into every part of our community and identify all of those factors that impact health. One of the phrases that we have been using recently in public health is what we call health in all policies. And the way to really explain that is housing impact health, how we plan our communities impact health, the decisions that we make about zoning codes impact health, transit impacts health, how we build and run our schools impact health, how we build, run our prisons impact health. And so in trying to improve health in our county, we've got to take all those things into consideration and ensure that we are very intentional about that. And I think one of the things that I've been here for since March last year, a little over a year, and most of what I've done has been largely around the COVID. At least publicly, there are several other things we do regarding health, but I think the COVID really did exemplify or bring to light really some of the challenges that we have. We, by its definition, pandemic does tend to overwhelm local resources, but public health across the country, we have not paid a lot of attention in the past few decades, and that showed up in terms of resources and in terms of updating policies. And a lot of those probably are outside of the local control, more at the state level, but we all saw the impact of a lot of those things on our ability to respond to public health. And our budget that's approved for 2021 is slightly over 21 million. Just under 13 million of those are local. Most are grant. And the FTE, budgeted FTE for 2021 is 149.35. Next slide. And so taking a look at the Home Rule Charter, what this really caught my attention is that it's to create a county government that serves not just our present, but also future needs. And I think that's very big. That's public health. We are a growing county and we're becoming increasingly diverse. And as you see in subsequent slides, being able to sustain where we are, just to maintain where we are, is going to take a lot more resources and intentionality on our part. But being able to improve, considering that our population is expected to increase in the next decade significantly, is going to take also intentionality on our part. Next slide. And so in terms of reporting structure, I report directly to Joe Connor, who is one of the assistant managers, and in the county manager's office. It's a pretty common option. It's not the only option, but it's a pretty common option, and it's, in my opinion, working very well. Joe, obviously a very great guy, but this reporting structure, oversight, feedback, facilitation of what needs to be done through the county manager, I think it's working very, very well. We have divisions. We are organized into divisions here. We've got community health, which is a division that works a lot on building relationships with our stakeholders, with our communities. We've got environmental health. And part of that environmental health is our child care licensing program. And so we permit the child care licensing establishments, we inspect them. And I think one of the biggest achievement during the pandemic was being able to keep them open. We realized very early on that that's very, very important to sustaining the economy. If people don't have childcare, it's very tough for them to go to work. So we put processes in place. Even at the peak, when we were getting over 500 cases a day, we were able to keep them open. We have our epidemiology division, which we created when I got here last year. Really, really thankful to our Board of County Commissioners for approving that. And you will have heard a lot about them in the past 1 year responding to pandemic. We work off of data. We work off of information and make informed decisions based on what the data is telling us. That was one gap that I felt we had, and that's one capacity capacity that we've been able to build. And moving forward in terms of building relationships with our partners, mental health, human services, our communities, those the epidemiology capability is going to prove to be very, very important. We have our Division of Health Services. Those are that's the department where most of the clinical activities are. They oversaw our vaccinations. That's where our nurses are, where you see when we're giving sometimes over 3,000 vaccines a day at our sites. Those are the nurses that you see. They were also the ones that were doing our testing programs, the mass testing programs, which we started around this region before others were doing testing in non-asymptomatic individuals. So that's pretty much the way that we're set up. We also have a division for strategy planning that basically looks at how we are set up, what's going on, relationship with the community. They do several assessments, and they are in charge of our workforce development and several other things. And then we've got our business operations division. I would also like to mention that our medical examiner is part of the Department of Health and Environment. And Dr. Peterson is typically out there working with our law enforcement and doing autopsies and providing us detailed information about COVID deaths and other related information across the county. Next slide. So as I've mentioned before, this is not unique to Johnson County. It is what is a problem that we're trying to solve nationally. Our county, for example, we've got over 600,000 persons. We are more diverse, and we need to ensure that public health resources are commensurate with the needs of the population. And so we have to be intentional about that. How you eat, how your physical activity, housing, all of those impact health. So if people want me, for example, to be more active, I've got to live in a community that is conducive for that. I've got to have sidewalks. I have to feel safe in my community. All those are important. If you want me to eat healthy, I need to have money to buy those things, but I also can only choose from the option that's available to me. So if I don't have grocery stores or places that sell healthy food close to me, if all I have around me are fast food joints, I can only choose from the options that are available to me. So part of our messaging, part of our approach, promoting health, improving health in the county, is to make the healthy option the default option. That's the option that we want to make readily available. If you do those things, you are going to invest less in obesity and funding things for asthma and those kind of other things. And that's true also for housing. And housing is a challenge. We have average housing prices going up by 90,000 in a year, and you're having multiple families living together. Those are not consistent with what you want in a healthy community. Next slide. And so I think this really does explain that. I think a few weeks ago, there was a new ranking that came out that ranked Johnson County as 44 out of, I think, 3,000 counties that were assessed. And that's really, really good. But for us in public health, we take a look at these things and we understand why. So there are different metrics there that were grouped under different categories. We did very, very well in many places, 3 places to be more precise, largely because of a high level of education, high socioeconomic status. One of those, for example, is rate of health insurance. We did pretty well, but the areas that we did not do well are areas of concern, and that's addressing issues of equity. We are becoming an increasingly diverse population. And I think one thing that comes to mind is this vaccination uptake, where we are seeing very low uptake in our minority population, and we're reaching out to them. But those efforts to reach out to our minority populations, those efforts to reach out to our populations that are of low socioeconomic statuses cannot begin when we have a pandemic. To build a trusting relationship is public health. And to do that, we have to do that ahead of time. We have to ensure that they're at the table. Typically at the table, you see the same group of people. We have to ensure that these communities are represented and we build bridges to them. And those are our plans moving forward. But look at the places where we didn't quite do very well: equity, housing, food and nutrition, environment, vitality. All of those are very important pieces. And we argue that if we don't improve in these areas, in the coming decades, we are going to see us drop significantly, because we can't even sustain where we are right now without an intentional effort to do that. And so next slide, I'm sorry. And so here's the point, is that a lot of where we are in health and many other things, where we are right now is a consequence of the decisions that we made 10, 20, 30 years ago. That's really what it is. And so where we will be 10, 20, 30 years from now will be a consequence of the decisions that we make. Now, do we make a decision for health? Do we put in, do we intentionally define health very broadly? Do we build bridges into our communities? Do we address issues of housing, transit, equity? All of those are things that public health is going to be working on, and we've been working on those, but we'll continue to work on those. And again, we have to be very intentional, and this should be continue to be key parts of our county's priorities and policies. Next slide. So the other thing that's been pretty evident, and this is not speaking about our county specifically, that's across Kansas, is the structure of public health and the structure of Board of Health. This is the first time in my over 20-year career that I've seen this much infusion of politics into public health. And so in many places, there is a Board of Health. And the Board of Health is different from county commissioners. It's really, for me, maybe a very difficult thing. Board of Health are primary advocates for health. They're advocating for health. But we have elected officials in Kansas that are also asked to act as Board of Health. And you see conflicts in those responsibilities. So those are things that in some way has to be addressed. Again, my experience with Board of Health is one in which they are advocates for health, and really across the state and other parts of the country. I think that issue is really magnified during this pandemic. Next slide. Another one that we're talking about that also happens in several other places is what is called the Public Health Leadership Council. And the Public Health Leadership Council model, you have, again, champions of health across the county. You have representatives from cities. You have representatives from our health systems, our hospitals. You have representatives from schools. You have representatives from our first responders, fire, police, key forces of change in the community. That's the phrase, forces of change. People that are not just there to understand the issue, but people that are positioned to advocate for health and make changes. So those are some of the things that we exist in other places, and it's a key part of their efforts to improve health. And those are some of the things that we're having conversations about now on how to move those forward and the best efforts doing that moving forward. So again, I know that there's not a direct thing on the charter right now that applies to the Department of Health and Environment specifically, but again, the language is the same, and several of the factors that are addressed are important to moving the needle in metrics of health. Happy to take any questions that you may have, but thank you for having me.
Thank you. Questions from the commission, Mr. Peterson?
Thank you for the presentation. When the community watched the discussions about various masks, it certainly appeared to me from the outside that there was a difference between recommendations coming from the health department versus decisions ultimately made. Can you, in that context, describe what would be, how it would operate differently if there were a Board of Health like you've experienced elsewhere versus the way it transpired here with the political elected officials sitting as the Board of Health.
Thank you, Mr. Peterson. I think there's always, to be clear, there's always the politics, other considerations to the final risk management decisions that you make in public health. But it was pretty clear to us that especially when we did not have vaccines, and that's also really been part of a document that national response strategy that has been prepared ahead of time, that you are going to have to take non-pharmaceutical interventions of wearing masks, physical distancing, and all of those things to protect our residents, and that's what we did, and make those recommendations. Your specific question to me is, how would that have played differently if you had Board of Health and advocates for health, and you have a structure that doesn't mix politics with those decisions. I would hope that the decisions will have come out differently. I will hope that the decisions that are made are supportive of health. Again, that's been my experience. Every Board of Health that I've seen, their primary goal is to advocate for health, and advocating for health in this instance and then is to wear mask.
Mike Beam.
Mike, thank you for the presentation. I think if we were meeting 2 years ago, this topic wouldn't necessarily be before us, although it's an important topic. I guess the question before we go down this rabbit hole to me is there something in the charter that could change this, or is this set up by statutes that we don't have any control over? If it's state mandated or things of that nature, then it's not within our purview. We can certainly support review of statutes or whatnot, but if it's not something that we can affect as a charter commission, I don't think we should spend a lot of time on it. I don't know the answer to the question.
I don't either. Dr. Ariola, do you know that whether the structure of this, or I guess we may hear from County Councilor, Deputy County Councilor Cindy Dunham.
This is Cindy Dunham from the legal department. To answer your question, this is dictated by statute. It says the county commissioners shall serve as the local Board of Health. And in fact, there's been a number of amendments during the COVID pandemic, and the legislature has addressed several issues that have been raised. And so it is dictated by statute. Now, that doesn't prevent something like an advisory board or something like that, but the county commissioners' role and duties and powers are set forth in statute.
Okay. So it's a lobbying effort by the commissioners, not by the charter. So, thank you.
Thank you, Mike. Good question to keep us focused on what we can do as a charter commission. Other questions for Dr. Ariola? Eric Michelson.
Thanks, Chairman. Just kind of a follow-up on that. Doctor, you picked a interesting time to join the county. Heck of a year for all of us, particularly you and your department. I want to thank you for a lot of sleepless nights and weekends, and your staff for what you did to try to keep us all safe through this historic pandemic. If we assume that the answer to the question of, in terms of a Board of Health is to be found in the statutes, not the charter, are you aware of any changes or impediments in the county charter that would make your mission easier, or that are currently impeding your mission as you see it now and in the future?
Thank you, Mayor Michelson, and thank you. On behalf of our staff, really thank you for your cooperation, especially through some of the difficult issues that we had to address during the pandemic. Thank you very much. So, no, I am not aware of any impediment in the charter as it is, and really, it's my presentation likely to use really talking about the weaknesses and gaps and what we are operating under. I think part of the challenge also during the pandemic, as Cindy brought out, were the many changes that were being made. I just wanted to make sure that I bring that to your attention as really what I think it's a very significant challenge based on our experiences the past 1.5 years.
Any other questions? If you're on Zoom again, just unmute and identify yourself. Questions before we close for today? Dawn?
Just for everyone, given what you know about pandemics and population growth and changes in the county, what would you change for the next 10 years?
Thank you, Ms. Dunn. Excellent question. I will say that we are working on what we call after action review and development of improvement plans, but there's no question that we have to build the capacity of public health to not just address existing current issues, but clearly to be able to be more resilient, more robust in responding to the pandemics. We clearly have to, and this has got to be top of the list, build relationships with every facet of our community. We cannot wait for a pandemic before we are reaching out to, hey, this group is not vaccinated yet. And if people don't trust you or respect your opinion if they don't have a relationship with you, and you cannot wait until that moment to start reaching out to the community. We are seeing that where we approach different groups, but we are approaching them anew. That building that trusting relationship, building obviously nurturing existing partnerships, but building new bridges into every part of our community has to be at the top of the list of what we do. We have to define the issues, not just in the boardroom or in our office here. We have to define them with the impacted community at the table. We have to view the issues from their lens and define the solutions along with them, so there's better ownership and support for the interventions that we choose. Those are very, very important bridges that we have to build.
We have time for a final question. If there's anybody on the commission that would like to ask Dr. Ariola a question. Hearing none, I'm going to release him, and we're ready to close the meeting. I do want to thank, in particular, the information technology staff, Bill Nixon, Bill Lopez, and Sean Nealon, who are here, and the public information office, Jody Hanson and Eric Schultz. Thank you all for your technical capabilities as we moved here. Our next meeting will be at the KU Edwards campus in person with virtual options for members of the commission. And we talked about our presentations earlier. Are there any other comments anybody would like to make before we close? Hearing none, I would accept a motion to adjourn. Moved by, was that Eric? Moved by Brent McCune and seconded by Karen Brownlee. All those in favor say aye.
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 Opposed, nay. Hearing none, that motion carries, and we are adjourned until July 28th. Thank you all.
Thank you.
That was my favorite session. I love all that.
Yeah.
It was easy. Make it easy for